Good evening, everyone. I'm Miranda Jones with Cori Bush's office. Thank you, everyone, for joining us today. We're going to begin the program very soon. Thank you again for joining us. We will be starting very soon. We're going to go ahead and get started. Good evening and welcome to Congresswoman Cori Bush's expert panel, the COVID-19 vaccine, your questions answered. I'm Miranda Jones, District Director for Congresswoman Cori Bush, and I'll be serving as moderator for this evening. This event will be recorded. In case you missed part of the town hall, we're also live streaming the event on Facebook. In the event that the live stream does get disconnected, we will post a full recording this evening. Before we begin, I'd like to give you a few details about how this is going to work this evening. First, Congresswoman Bush will give opening remarks and an update. Then we will have segments of the root video with an expert position, which is an epidemiologist and anti-racism activist, Dr. Karma Jones, about the COVID-19 vaccine. After that, we will hear 1 minute of opening remarks and updates from our expert town hall panel, and then we will go on to our question and answer portion of the evening. Today's panel of experts include Dr. Alex Garza, Chief Community Health Officer for SSM and the Incident Commander of the St. Louis Metropolitan Pandemic Task Force. Dr. Kendra Holmes, Vice President and Chief Operation Officer for Affinia Healthcare. Spring Schmidt, Acting Co-Director for the St. Louis County Health Department, and Dr. Frederick Echoes, Director of the City of St. Louis Health Department. We are grateful to our panelists for giving us the opportunity to better understand the COVID-19 vaccine. We will start with pre-submitted questions for the panelists, and then we will take a few live questions through our Zoom question and answer feature. Without further ado, I'll let Congresswoman Cori Bush kick off this town hall evening.
Right. Okay, well, good evening, everyone. Thank you so much for being here on this town hall. I am so grateful to be spending this evening with all of you. Thank you for joining us tonight for the first of many town halls, community events, and conversations to come on this, the first day of Black History Month. You know, you could have been doing so many things this evening, but you chose to be here in community with hundreds of our fellow neighbors to ask questions and to hear more about COVID-19, the COVID-19 vaccine, and the urgent need for its equitable distribution. So thank you. I have had the honor of being your Congresswoman for 4 weeks now. And what a 4 weeks it has been. Since being sworn in on January the 3rd, we faced an insurrection, an impeachment, and witnessed a historic presidential inauguration. Since so much has happened, I want to do a brief recap of the past month to update you on the work my team and I have been doing on your behalf within the halls of the People's House. I've introduced 2 pieces of legislation, the first of which was introduced during my first week in office, which is House Resolution 25. It calls for the investigation and expulsion of members led by Josh Hawley and others whose racist attempts to overturn the election resulted in an attack on the US Capitol. We impeached Donald Trump for his role in this insurrection, and now we must hold our colleagues in Congress accountable too. Less than 1 week ago, I also teamed up with Senator Ed Markey of Massachusetts, who's the author of the Green New Deal, to introduce the Environmental Justice Mapping and Data Collection Act of 2021. Our bill would federally fund and create an interagency committee to develop detailed maps of key indicators of environmental racism, which we need, such as air quality and fossil fuel infrastructure, and police violence. Yes, I said police violence that affect St. Louis and communities just like ours on a daily basis. This data will be used to help direct nearly $800 billion in clean energy transition funding to the communities most affected by these environmental hazards, including many in St. Louis. I am very proud of these two pieces of legislation, and even prouder that I got to work with partners on the ground here in St. Louis to help develop them. We will continue to center St. Louis in everything we do. Earlier, I mentioned impeachment. The decision to impeach the president was one that I did not take lightly. But Donald Trump has been a threat to our community since the day he rode down that escalator. His impeachment was necessary. You cannot incite an insurrection and get away with it. He has been a historically dangerous president, and now history will remember that he is the only president to be impeached twice. During my impeachment debate remarks on the House floor, I made clear what those of us in St. Louis already knew. Donald Trump was the white supremacist in chief. He incited an insurrection, and next week, the Senate must convict him so that he may never hold public office again. I also partnered with County Prosecutor Wesley Bell to call on President Biden to end the death penalty by reducing the sentences of all on federal death row. Donald Trump executed 13 people over the course of 6 months. 13 people over 6 months, which is more than any other administration in over a century. In order to build a more just, a more dignified democracy, we cannot allow a flawed and racist practice like the death penalty to continue. St. Louis is now leading the national charge in the fight for justice, and this is just one step of so many more that I will be taking as a member of the House Judiciary Committee to bring true justice into our criminal legal system. But today, we're here to talk about the COVID-19 vaccine and COVID-19 relief. We are nearing almost 1 full year since the virus upended our lives, our economy, our health, and our ability to socialize and be with those we love. More than 26 million people across the country have been infected, and over 400,000 people have lost their lives. 400,000. In Missouri, there has been nearly 500,000 cases and over 7,000 deaths. We lost 7,000 Missourians, you all. It's no secret that this pandemic has disproportionately devastated Black and brown communities. Black folks are 3 times more likely to die from COVID-19 than white people. We are more likely to be evicted from our homes, face unemployment. And despite all of what we know and have found out since this pandemic started, we are less likely to have access to the vaccine. I am encouraged by the steps the Biden-Harris administration has taken to combat this pandemic, enacting a mask mandate in all federal buildings and interstate travel, ramping up production of the vaccines, committing to getting our schools reopened safely, and taking steps to get not just 100 million shots in the arms of people within the first 100 days. Not just that, but enough to ensure that 300 million people can be fully vaccinated by the end of summer. That would be 90% of the US population. That means that we will finally begin making progress to overcome this pandemic as a country. And I'm so glad we have an administration that believes in science, y'all, that we can work with. But I'm also concerned that our efforts to climb out of this crisis will not be done equitably. That is why I am leading a letter to the Biden administration this week, urging them to prioritize communities of color in their distribution plans. It is reported that Missouri ranks dead last in its rollout of the vaccine. Now, I am confident the federal government will do its job, but as resources come in, we need to ensure that the state is directing those resources right in St. Louis. I have spoken to the governor, and I will continue to do so to ensure that our community has access to not just the vaccine, but we need the access to the relief. This week in Congress, we are considering a budget resolution to pass President Biden's plan that includes $25 billion in rental assistance, $5 billion to provide housing for our unhoused community, $400 per week in unemployment insurance, another round of stimulus checks, and a total of $1 trillion in direct relief for families. But I know that that won't be enough. So I am fighting to ensure that those survival checks are increased to $2,000 and given monthly through the end of this pandemic, and that those unemployment checks are increased to at least $600 per week. This is what I am fighting for. I'm fighting to ensure that we can get hazard pay for our frontline workers. I'm fighting to ensure that we can cancel student debt and provide healthcare to those who are uninsured. I will keep fighting to do the most for everyone in St. Louis, starting with those of us who have the least. So tonight, we are lucky to be joined by public health experts, Dr. Alex Garza, Dr. Kendra Holmes, Dr. Frederick Eccles, and Spring Schmidt, who will fully introduce shortly. But we get to our conversation with our panel. Before we get to our conversation with our panelists, I want to share a brief video from a conversation about the vaccine that I had with Dr. Kamara Phyllis-Jones, a physician, epidemiologist, anti-racism advocate, and the former president of the American Public Health Association. Like many of us, even I had reservations about the vaccine, and my reservations were serious, y'all. I mean, like for real, I had some real reservations. I hear my neighbors and my friends loud and clear that we do not want to be guinea pigs. I understand. Racism is present in every single part of our society, including healthcare, and it has been that way. As a nurse and as someone who survived COVID-19, I know this. And we know the history. And we know that today there are stark disparities in health between Black and white people, not because Black people are predisposed to illness, but because of the structural racism and inequality that affects the housing we live in, the air we breathe, and the water we drink. Right now, we are dealing with a virus that touches every single one of our lives, all while disproportionately harming Black and brown people. We are being infected more and dying more because of COVID-19, but that doesn't mean our concerns about this vaccine aren't valid or that we don't deserve to have our questions answered. I'm someone who has, if you didn't know, I'm someone who has long been uninsured. And I currently don't have a primary care physician to ask my questions about the vaccine. Dr. Jones and I sat down to have an honest conversation about the vaccine and its safety. It answered a lot of my questions, and I hope it helps answer some of yours too.
When they inject you, that fat bubble is going to allow the little snippet of messenger RNA. It is not the virus. It's a little bit of messenger RNA that goes into your cells and uses the machinery of your cells just to produce the spike parts of the virus so that our immune system can recognize the spike and say, oh, there's something really wrong going on here. Let's get prepared. The reason you need 2 doses is we sort of prime the body with the first dose to recognize the spike, and then we boost the body in 3 weeks with the Pfizer vaccine and 4 weeks with Moderna so that we can have a full-on response if we as people ever encounter the real virus and we go into full attack mode and we immobilize it before it makes us sick. We don't know if it's going to stop us from getting enough that we could spread. We do know that these vaccines will stop it so that 94 to 95% of us who get the vaccine will not get sick.
Are there any negative side effects to the vaccine that people should know?
When they get the vaccine, their arm might get sore, maybe even more sore after the second one than the first, that they might feel a little tired and need to take a nap that day. Rarer is maybe you get fever that you could take, some ibuprofen or aspirin with, or some muscle aches. Those side effects are showing that the vaccine is working, that your body is gearing up in reaction. These are not unexpected side effects, but that's it. After a day or so, you shouldn't have anything. These vaccines are, pardon my French, damn good vaccines. These vaccines offer a lot of protection against a disease that is devastating our community. Nobody should be in the position of trying to convince anybody to take something, but we need to honor people's questions, answer them truthfully, where many of the answers might be, we don't know, or we don't know yet. But I just want to say, so I'm clear and on the record, as a physician, as an epidemiologist, as an anti-racism activist, I have looked closely at these two vaccines. I have decided that they are so effective. For me, as a person, I'm going to take it when my turn in line comes, rather than risk dying from COVID-19. This pandemic is having such dire effects in our communities that we should seriously consider protecting ourselves in all the ways that are necessary.
And I'm going to go ahead and get the vaccine. You have given me what I needed, so I'm going to go ahead and get it.
All right. So I hope you all enjoy watching that little bit of a full conversation. It's a lot more to that conversation, and it is actually on our social media. It answered a lot of my questions about the vaccine, and I do plan to get the vaccine in the coming weeks. It's my hope that this video has also answered a few of yours, and will when you watch the full one if you choose to. So with that, I'd like to turn things back over to our wonderful moderator for the evening, our district director, Miranda Jones.
Thank you so much, Congresswoman Cori Bush. I am truly inspired. Your work is just incredible. Next up, we have our expert panelists. First up, we have Dr. Alex Garza. He will give his opening remarks and an update. Dr. Garza is the Chief Community Health Officer for SSM Health and the Incident Commander of the St. Louis Metropolitan Pandemic Task Force. He is responsible for deepening SSM's health focus on social determinants of health, equity, and social justice. I'd like to turn it over to you, Dr. Garza.
Well, thank you, Miranda, and thank you for inviting me to be a panelist here this evening. I thought what I would do is just give a really brief overview on where we are with the pandemic, and then turn it back over to you. So right now we're in sort of this weird period where we're starting to see the decreases in the number of cases as well as hospitalizations, which is really good news. The challenging thing is that we still don't know what those different variants, that UK variant and South African variant, are going to do to the population. And we all know that we're challenged with getting enough vaccine out into the community. So it's a balancing message of hope for cases coming down, remaining vigilant, and then making sure that we're getting enough vaccine out into the community. But I will say, though, it's been a tremendous partnership in the St. Louis metropolitan area with all of my friends here on the panels from public health, the other healthcare systems, our elected officials, and the federally qualified healthcare centers, as well as the business community. They've been tremendous as well. So thank you.
Thank you, Dr. Garza. Next, we have Dr. Kendra Holmes giving her opening remarks and an update. Dr. Holmes currently serves as the Vice President and Chief Operations Officer for Affinia Healthcare, formerly Grace Hill Health Centers. Dr. Holmes has a passion for improving the lives of underserved populations. She is an advocate for social and economic justice. Dr. Holmes.
Thank you, Miranda. And thank you, Congresswoman Bush, for your advocacy and your support of underserved communities. So you mentioned that this is the first day of Black History Month. So I just want to say that it is important for us to acknowledge the many contributions of Black medical professionals during Black History Month. But it's also necessary to point out that systemic racism is very much embedded in our healthcare system. So that fact has been made very much evident with the disparities that we've seen in St. Louis with Black and Brown individuals experiencing the COVID-19 pandemic. So very simply, COVID-19 vaccination is a matter of life or death for many of the individuals that I see every day in my practice in the community. So Affinia Healthcare, since day one of the pandemic, we have made COVID-19 vaccination a priority in the most underserved communities. And that's in North St. Louis City, North St. Louis County, South St. Louis County, any place where, again, there is a specific need for the most vulnerable in our communities. 90% of our patients live with incomes well below the poverty line, and about 85% of our population are minorities. Since April 2nd, we've provided over 26,500 COVID-19 tests, and we'll continue these efforts to assure that residents of the first district have access to this vaccine, and not only just to the vaccine, but for the education piece to make informed decisions about what they want to do with their bodies. Thank you.
Thank you, Dr. Holmes, for the incredible work you're doing in the community. Next, we have Spring Schmidt. She will give her opening remarks and an update. Ms. Schmidt is the acting co-director for St. Louis County Health Department. She has been with St. Louis County for 8 years, but has been working in the field of health education for the last 15. Thank you, Dr. Schmidt, for being here, and it's on you.
Thank you very much. I couldn't agree more. I think in some of the things that we've faced that have been levers in this pandemic and how it has exposed things that we've worked on with the health department and other public health agencies and FQHCs for a long time. The St. Louis County Health Department has run 3 clinics where we're the primary care provider for about 35,000 St. Louis County residents. And about 60% of those have no other source of insurance besides what St. Louis County covers for them. And about 90% of them are also Black and Brown people in our communities as well. As this pandemic went through our community, we worked to stand up testing sites as well. We do case investigation and contact tracing. We have reached out and put 3.5 million pieces of PPE in the hands of community residents across St. Louis County, particularly in our North County area. And we also, as we got CARES funding, put $7 million out, particularly for North County. And we used participatory budgeting to do it, where we turned all the power of the money over to the people who said what services they wanted and who they wanted to deliver it to them. As we continue to move through this, we are standing up sites to deliver. We hope to deliver approximately 5,000 vaccines a week. We have received some so far. And with a consistent supply from the state, we know that we can deliver a readily expandable group of vaccines. We will set up drive-through clinics and mobile services. We have a site, our primary clinic that's up right now in North County, and then we have 2 more that are coming up very soon.
Thank you so much, Ms. Schmidt. Next, we have Dr. Frederick Echols give his opening remarks and update. Dr. Echols is the director of the City of St. Louis Department of Health. He is a current member of the American Public Health Association, Council for State and Territorial Epidemiologists, and several other professional organizations and national work groups. Dr. Echols.
Good evening. Thank you, Congresswoman Bush, for this opportunity, and Miranda Jones for facilitating this discussion. I'll echo the sentiments of the other panelists. So the COVID-19 pandemic has not shown us anything new. What it has done is really highlighted the inequities and disparities that are the consequence of systemic and racial, systemic and structural racism in our governments. And so one of the priorities for the City of St. Louis Department of Health is not to just understand what's happening during the COVID-19 pandemic, but to understand the landscape of health prior to COVID-19, because that really set the tone for what was going to happen during the COVID-19 pandemic. A lot of the inequities that we report on during the COVID-19 pandemic, we've been reporting on those for decades, if not longer. And so what we have now is an opportunity to do something different, to really change the trajectory for our most vulnerable population and give everyone an opportunity to achieve optimal health. And that requires systemic partnership and leveraging of resources across agencies. And so over the last 10 months, the City of St. Louis Department of Health, we've worked alongside the St. Louis County Department of Public Health, the St. Louis Metropolitan Pandemic Task Force, which includes all of the local area hospitals, as well as the federally qualified health centers, who've played a critical role in helping us lift this work that's necessary for us to get through this pandemic successfully. However, as we look at where we've come from, we also have to have a vision for where we need to go. And so as we look at these additional resources that we're getting through the federal government and through the state, and we have to make sure we're being mindful of how we utilize these resources to really put our community on a higher platform again, so that they are empowered to achieve optimal health. And so that's our priority, and it's part of our vision, and so that's what we're working towards.
Thank you so much, Dr. Echols, and thank you all our panelists. We know that you're working extremely hard to take care of our community, and we really appreciate you. Before we start the Q&A, we have a few pre-submitted questions. I like to keep inviting you all on Zoom to submit your questions. Go to the Q&A button at the bottom of your Zoom screen, and to ask a question, click on it, type your question. Thank you to everyone who submitted pre-submitted their questions. And to those who we will get to the live questions, we know we may not be able to answer all the questions, but we're going to do the best that we can to get as many questions in as possible. So we're going to jump right in with the first question. So Dr. Echols, I'm coming to you first. The first question is Andre from St. Louis asked, is it true that the vaccines are currently being distributed are not approved for emergency use and are not approved by the U.S. Food and Drug Administration? So they're only approved for emergency use and they're not approved by the U.S. Food and Drug Administration.
That's a great question that was raised by Andre. So that's the one question that we've received a lot at the City of St. Louis Department of Health. So the two vaccine products, so the Moderna and the Pfizer product, have been approved by the Food and Drug Administration under an emergency use authorization. The emergency use authorization is an authority that's granted to the Food and Drug Administration, which allows them to implement different measures to protect the public's health, whether from chemical, biological, radiological, and nuclear threats, and by the use and approval of medical countermeasures such as vaccines. And so, yes, right now the Pfizer and Moderna vaccines have been approved under emergency use authorization by the Food and Drug Administration.
Thank you. Dr. Alex Garza, Mary from St. Louis asked, will the exposure to a new strain of COVID-19 require an additional shot in the arm? We have a lot of questions about the new strain of COVID-19. Can you speak to that?
Yeah, so what we know about the new strain is it depends on which strain you're talking about as well. So there's a couple of different ones. There's a UK variant, there's a South African variant, there's even one from South America. I think the one that's gained the most media attention is the one from South Africa. So there is evidence in the literature that says some of the vaccines aren't as what they call efficacious against the strain from South Africa. Now, what does that mean though practically? What that really means is the efficaciousness is still high enough to protect you from severe disease, just maybe not as well as the normal variant that has been circulating around. So a couple of different things. Moderna is looking at developing a booster dose that would protect be more efficacious against that South African strain, but it'll take some time to work through that. Bottom line is though that the vaccines work well enough in those other strains that most people won't need to get a booster shot or notice anything different. You have to understand that that shot is still effective enough. It's even better than the flu vaccine that we get every year. And so it's still a really good vaccine. So I wouldn't hesitate at all to get this to protect against those other variants.
Dr. Garza, a couple other questions for you. Michael from Webster Groves has a two-part question. One is, how long does immunity last? And also, if you can explain who is currently eligible to be vaccinated.
Sure. So the first part, the short answer is we don't know. The longer answer is we have noticed antibodies in the blood from anywhere from 6 months, even up to 9 months. But you have to remember, this is a new vaccine. And so we are learning about the immunity status as we're going along. Now, I'm participating in the Moderna vaccine trial out of St. Louis University. And so they are, tracking if I get sick and then taking blood samples, things like that as time goes along. So you can learn more about the immunity status. So bottom line is we don't know, but we believe it lasts, at least long enough to get through the pandemic and probably longer. On the second part, for eligibility for vaccine, and this is very important, the eligibility in the state of Missouri, and it differs from state to state, is anybody that's 65 and older, anybody from 18 to 64 with a chronic medical condition. There's a list of about 10 of them on the state website. But what is important to know, though, is because this is such a large population and we have such a limited amount of vaccine, that we're trying to be as effective as we can in delivering vaccine to those that are the highest vulnerability. And it's usually the elderly population, so the greater than 75 years, and then trying to work our way down. So we know there's a lot of people that are eligible, but there's an extremely limited amount of vaccine right now.
Thank you, Dr. Garza. We have several questions about when specific populations will be eligible, starting with this one from Sarah from St. Louis. And I'm going to direct this to you, Spring Schmidt. Will there be prioritization for children and adults with disabilities?
So let me talk about the adults in particular so far with disabilities. The state does set these tiers, as Dr. Garza said, and currently people with potential mental or intellectual disabilities have been included in that list of 10 conditions that he talked about for people who are 18 to 64. Children, however, currently both the Pfizer and Moderna vaccines do have different ages at which they start at. So for the Pfizer vaccine, it starts at 16 and for Moderna at 18. And so there are studies that are currently being conducted that are looking to bridge to those younger populations to see how the vaccine does perform for children under those ages as well. So we have a committee on disabilities that is working with those communities to talk about how best to roll out vaccine and prioritization, but they are currently eligible as tier 1B2 patients in Missouri.
Thank you, Spring. I'm going to move back to Dr. Garza for a second. One question from Beth from St. Louis asks, when will teachers be eligible for the vaccine? We have a lot of questions about teachers and schools opening. And also, can we expect the vaccine rollout to speed up now that Biden's in office?
Yeah. So the teachers are in the next phase in the spring, and Fred can correct me if I'm wrong about this, but after we get through the 65 and older and the 18 and 64, then it's the next step is to include teachers. But it's also widening a group to a lot of other essential workers as well. So it'd be teachers plus a lot of other folks, but that's where we are. But again, just to level set, the group that we're in right now is a very big group. And so getting through that population is going to take time. Just so everybody knows that. Will it speed up because of the Biden administration? I think it will, but a lot of that is dependent upon the vaccine manufacturer. And so if we can increase manufacture of vaccine and get that pushed down from the feds to the state, to the locals, that is the key. So if Pfizer can increase production, if we can get Johnson & Johnson through the EUA process, both of those things, and Moderna increasing production, that is what's going to help. Now, Biden did invoke the Defense Production Act, and he has thrown a lot more resources into getting production increased. And so I do believe that will end up with more vaccine, but it takes time to ramp up all of those processes. So we're not going to see anything in the near future, but I think down the line, we will see much more vaccine becoming available.
Thank you, Dr. Garza. Next question, Dr. Kendra Holmes. Natasha from St. Louis asked, would you recommend pregnant women proceed with the vaccination? And will vaccinations be available later in the year, like after birth? We have a lot of questions about pregnant women in the chat. Can you speak to that, please?
Sure. So recently, the World Health Organization changed their language, just actually past Friday, related to pregnant women and the COVID-19 vaccine. And what they basically said is that the risk of vaccination does not outweigh the benefit. So that's to say that there's no contraindication unless you have a specific contraindication related to an allergic reaction to that specific vaccine. Also, individuals now who are recommended, who are pregnant, are those who are at increased risk for transmission. So if you were a pregnant nurse or you were a pregnant firefighter or law enforcement, you would be in that group that is now recommended to be vaccinated. Also, those conditions that Dr. Garza spoke of. So if you're an individual who's pregnant who also has those specific chronic illnesses, you would be recommended to receive the vaccination. So, and this is something that's really important to the patients that we see. A lot of Black women have a lot of, comorbidities related to pregnancy. So as far as diabetes or hypertension. So those individuals really do need to have a discussion with their healthcare provider to make sure that the vaccine is, recommended for them. But yes, if you are an individual who is pregnant and you are at risk for contracting COVID-19, we definitely want you to receive the vaccine after speaking and consulting with your provider. Will vaccine be readily available afterwards? Yes, but we want to vaccinate you, when you need to be vaccinated. So during pregnancy is an optimal time if you're at risk.
Thank you, Dr. Holmes. We have a lot of questions about access. The first one will be for Dr. Frederick Echoes. What steps are being taken to ensure that communities in the Missouri 1st District that need the vaccine the most are getting access to both doses?
And that's another great question. So in the city of St. Louis, we've been working with various agencies who work regularly with our most vulnerable population. One of those populations are, two of those populations are the elderly and individuals who are homebound or those who have functional needs. And so we are working with the St. Louis Area Agency on Aging because they have a working registry of individuals who have functional needs and who may be homebound. And so we're working with them to make sure we have a working list of those individuals who may need us to go to their homes or to a particular facility to administer the vaccine because they aren't able to make it to the access point that we established otherwise. In addition to that, we'll also be working with FEMA to implement a mobile program where we'll be using a mobile unit that goes out into the community to administer vaccines to individuals in their homes or designated locations, again, because they're unable to come to other vaccination sites. This is really critical because oftentimes what happens during public health emergencies is our most vulnerable populations are left behind. And we're trying to do our very best to make sure that doesn't happen during this pandemic. And again, as I tell my staff all the time, we have an opportunity to do something different. And there's no greater time than the present to actually make that, to make that change. And so, but this has to go beyond the present or the COVID-19 pandemic. Whatever solution we implement needs to be sustainable over time because we don't want to get through the pandemic and then those populations are left worse off than they were before the COVID-19 pandemic. So we're looking to implement sustainable solutions over time to make sure that our most vulnerable populations are not left behind after COVID-19.
Thank you, Dr. Echoes. And I'm noticing in the chat, a lot of people are asking specifically about homebound seniors. And he did say, yes, they're working with FEMA. He also talked about the Aging Council on Aging, and some people are not registered. And so we are going to be putting information in the chat. We're also going to have a website that we'll give you guys at the end with a lot of resources so that there's some hotline numbers you'll be able to call to get some of those questions answered about homebound seniors. And I'm seeing those questions come up. So just know we will have additional resources throughout the webinar for you all to be able to call and to get more resources. The next question is for Dr. Holmes, as well as Congresswoman Cori Bush. What is being done to get the vaccination to African Americans? Will there be community-based sites? And I'll start with you, Congresswoman Bush.
Sorry, I had to unmute. Yeah, so of course we know racism is a public health crisis, period. So we have a lot of work to do to dismantle the structural and systemic racism in our society. We have, we're looking at that. We can't do this without talking about that. It's not an accident that Black communities have been hit hardest by this pandemic, economic crisis, policing. Black women and women of color have borne the brunt of unemployment. Black and brown communities have been infected and are dying at 3 times the rate of white people due to COVID-19 and are more likely to be uninsured and in our community. St. Louis is leading the nation in police killings. These experiences we know all too well. That is why I've co-sponsored legislation by Representative Barbara Lee called the COVID Community Care Act. So if passed, it would provide grants to community-based organizations and nonprofits in Black and Brown communities to conduct outreach to our communities that have been hit the hardest. It would allow community leaders, clergy, community health center providers, and other trusted leaders in our community to help with the testing and the vaccine uptake. You know, I think it's also important that we have medical providers at the distribution site so that if anyone has any adverse side effects, that they can get the free treatment, because I think something that's been near and dear to my heart is what happens to those who are uninsured. When they have the vaccine, what if something doesn't happen in the first 30 minutes? What if something happens, you know, if they're feeling ill later? What happens to our unhoused population if they receive it? If they receive the vaccine, what happens? What happens to our people who are incarcerated? But thinking about that, even myself, up until today, like today, February the 1st, literally today, I've been uninsured. So I was the uninsured congresswoman up until today. So I plan to consult with my own physician here shortly in the coming weeks. And based upon that recommendation, I'll plan to take the vaccine myself, because I believe the benefits outweigh the risks, you know. But in the meantime, I'll keep doing everything that I can to ensure that you all, our community at large, can feel as confident as we can about this vaccine, you know. And let's remember that the other public health measures, are necessary to keep ourselves safe. Don't forget the social distancing, the hand washing, the quarantine, you know, and make sure we're wearing those masks. And I'll let Dr. Kendra Holmes go into it a little deeper.
Sure. So as far as the community outreach, what we're doing at Affinity Healthcare and many of the federally qualified health centers are doing is what we've done with the testing. So a lot of the community health centers were first in those underserved areas. So we went to public housing, we went to unhoused encampments. So all throughout the St. Louis area, North County, South St. Louis City, and North areas, really going to where the community needs us. Transportation is a huge issue for many of the individuals needing vaccination and testing. So it's important for us to have our mobile units throughout the city, throughout the county, going to those, again, public housing, schools, senior living facilities, wherever there is a need. So that's really our top priority. Trust is something that we always need to really have a discussion about, because, you know, you can have access, but if individuals are not utilizing the care, if, you know, you just have a line of individuals who are more affluent coming to your testing or getting your vaccinations, we're really not meeting the need in the community. So what we do is, you know, we listen to our patients. We've been in the community for over 100 years. Health equity is nothing new to us. We've been doing this, you know, forever. So, you know, I think that a lot of organizations who are active in the community do have the trust of the community, specifically the Black and Brown population. It's important to continue to provide high quality health care, to, you know, really lead by action and not words, and just talk about health equity, but to make it a priority, as Dr. Eccles said, you know, a systemic priority for not just community health centers, but all of healthcare.
Thank you, Dr. Holmes. Thank you, Congresswoman Bush. We're going to switch over to live questions in 1 second. I have one more question for Spring Schmidt. Shalonda from North St. Louis asked, when will families in North County be able to receive the vaccine if they do not have medical insurance?
So medical insurance is no barrier to receiving the vaccine. Please get registered and come on in and get signed up to get the vaccine. We have 2 facilities in North County open now, our clinic at John C. Murphy in Berkeley, and the Florissant Valley Community Center, or the community college campus that's up in North County as well. So please get registered with us. You do not need to have insurance. We're trying to have as few barriers as possible because we want to get you in.
I have a live question from Brittany. What is the plan and the timeline to vaccinate more vulnerable populations in the area, like those who are unhoused? So let's speak about the unhoused population. And Dr. Eccles, I'm going to switch this question over to you. Dr. Eccles, can you speak about the unhoused population?
Absolutely. So again, one of our most vulnerable populations. One of the challenges that we have, particularly with the 2 vaccines that are currently approved under emergency use authorization by the FDA is that it requires two doses. And so for our unhoused population, we want to make sure they have access to not only the first dose, but the second dose. Because they're a very mobile population, we have to be really mindful of that as well. So we have good working relationships with all of the homeless service providers in the city of St. Louis, but making sure that those individuals can have access for their second dose is really critical. Because we want to make sure we follow the protocol that's outlined in the clinical trials data, because that's what the data is based off of. And so we want to make sure we aren't unnecessarily causing any harm by not following those protocols. And so by continuing to work with the Department of Human Services in the city of St. Louis and homeless service providers, we'll be working to get that population vaccinated as soon as the state moves us to tier 3.
Thank you so much, Dr. Echols. Another live question. So randomly, it's going to someone out there. And I'm going to say, Dr. Garza, this one is for you. People are asking, this vaccine is way too fast. It happened way too fast. And they are saying, isn't this too quick for a vaccination to be developed? Can you speak to how this happened so quickly?
Sure. Well, there's a couple of reasons for it. So one was a tremendous amount of investment by the federal government, but that was mostly in the Moderna vaccine. And I believe the Johnson & Johnson. Pfizer developed it on their own without accepting any federal dollars. So that's one piece. The second piece, the first two that came out of the gate were these mRNA viruses or vaccines, brand new vaccines that have not been used. But people have to understand this was decades worth of work that had been happening just for this moment. And so they were able to use the technology, able to use the know-how to develop these vaccines quickly because of the unique platform that it is with the messenger RNA vaccines. But one thing I do want to make sure that everybody understands, the vaccines went through all of the clinical trials that are required for vaccines. So they went through the phase 1 trials, they went through the phase 2 to make sure that they were safe, and they went through phase 3 to make sure they were efficacious, which means did they actually work in the population? Now, another reason why it seems fast is because there was a parallel manufacturing process along with the testing process. And that was done deliberately so that if you could get through the trial and you had success, that you could start pushing vaccine out as quickly as you could. Most vaccine trials, you wait until you have that authorization, and then you start manufacturing, and then you deliver. So there's a couple of different things that make it seem really fast, but in essence, there was a lot of things going on in the background that really moved it along quickly.
Thank you so much. I'm going to direct this to Congresswoman Cori Bush. Congresswoman, people are asking, is there a national plan on how the vaccine should roll out? And, why should we do this state by state or county by county? It just seems like it's all over the place. Can you talk about the national plan?
Sure. Okay, here we go. Yeah, let's be clear. We are still digging ourselves out, you all, from under the chaos of the Trump administration. The previous administration promised 50 million doses of the vaccine, and that will be distributed by the end of January, which we now know is nowhere near what has happened. According to the Centers for Disease Control, about 24.1 million people have received at least one dose of the COVID-19 vaccine, which includes 5.3 million people who have been fully vaccinated. The Biden administration has announced its plans to ramp up production of the vaccine and is in the process of signing an agreement with Pfizer and Moderna for 300 million doses by the summer. The Biden plan will also aim to have 10 million doses of COVID-19 vaccines shipped across the country each week, which should help states prepare and make plans for distribution. I think one thing that we have been hearing is just how not knowing what was coming was an issue. And so those organizations, those mental health centers, I'm sorry, not mental health centers, those health centers could not plan. And so as far as what we know right now, it should be like, I'm hearing like 2 weeks, like they'll know for 2 weeks. They'll have an idea 2 weeks ahead of time about what they'll be receiving. So that'll help to make the distribution better. Like I said, before, I've had concerns about what's happening, especially locally, about us not receiving the vaccine or having priority when it comes to its distribution. Our residents, many of whom are essential workers. We have a lot of essential workers. Our elderly, our unhoused, our uninsured are more likely to be infected and face severe complications as a result. So this afternoon, I did call on the Biden administration to address these equity gaps in distribution and to ensure that our underserved communities are considered priority as part of those efforts. And I will continue to monitor how this is going at the federal level. But I also know that while the federal government is sending vaccines to each state, we have to do better in Missouri. With us ranking, as it's reported, dead last in the rollout, getting these shots in arms. I'm doing my job at the federal level to ensure the funding and resources are making its way to the state as best I can. We are engaging with the White House, the Department of Health and Human Services, which houses, of course, CDC and FEMA and other agencies. So Congress is set to pass, another COVID-19 relief package in the coming weeks that will provide critical funding for community health centers, mobile distribution units, and 100,000 public health workers, and for our schools. Recently, I talked with Governor Parsons personally and requested a state equity plan. And I requested a state equity plan to ensure St. Louis is not left behind. I'll continue to speak out and to speak up about this issue because our communities have been hit the hardest and we cannot be overlooked. Our safety has to be priority as well as recovery.
Congresswoman Bush, does this plan include another stimulus check? There's a lot of questions about, will we get another stimulus check?
Yes, as many of you have heard, Congress is reconvening this week to vote on a budget resolution that will allow, so we have to do this first, and it will allow us to pass another COVID-19 relief package. And with that, you've probably heard, we are working to ensure that we can pass this $1.9 trillion rescue plan, which includes another round of what people are calling the stimmies, round of stimulus checks at $1,400. It will be it'll be expanded this time. So it'll include adult dependent children, which I know was an issue for a lot of you. So it includes adult dependent children and mixed status households. But let me say, we know that's not enough. That $1,400 to add on to the $600 from December. Look, we know that's not enough. So I've been fighting and I'll continue to fight you all for $2,000 a month, retroactive survival checks for the duration of this pandemic. We promised $2,000 a month, and I believe that we need to make them recurring so that people who are struggling can pay their bills. We can keep a roof over our heads. And more than that, let me just say, my colleagues and I in the Congressional Progressive Caucus are also fighting to renew the expanded unemployment insurance at $600 per week. We understand that change, that decrease in the unemployment insurance, it really hurt people. So we are working on that. Also, to provide retroactive hazard pay for our essential and frontline workers, to increase SNAP benefits so that our children, families, and seniors don't have to go hungry, raising the minimum wage with a phase in to $15. That's what it is. It's a phase in. Wish it could be immediate, and provide more funding to help people pay their rent and mortgages, and expand Medicare and Medicaid so that those who are unemployed and uninsured can stop fearing when they get sick that it'll bankrupt them. So, and lastly, the Biden plan includes $1 trillion, you all, $1 trillion in direct aid to families. I said that before, but I just want to make sure that we know that this is what we're working on. So yes, stimulus, $1,400 for the stimulus for right now.
Thank you so much. We have so many questions and we are running short on time, so we're going to try to get a few last questions in. I want to remind everyone, you can put your questions in the question and answer, and we're going to do our best to make sure that we post these frequently answered questions or asked questions on our website so that you can get your question answered. We know that we can answer questions all night, but we want to respect your time and we want to make sure that we can get the information that you need. So we'll have a lot of resources on the website. We'll post a link for the website right after the webinar. So please, if you have questions, hit the Q&A button at the bottom. There's a lot of questions that are being put in the chat, but if you can put it in the Q&A, that's where we're going to go and make sure we answer those questions. Really quickly, how do people register for the vaccine, especially if you don't have access to the internet? And I'm going to direct that to you, Spring Schmidt. How do people register?
So there are multiple ways to register. Unfortunately, it is with multiple places. And so you can register at St. Louis County on stlcorona.com. I know the city has a list that's up on their website also. Each of the hospital systems have a place where they can register. And so I know that the Post-Dispatch and I think some of the other current magazines and newspapers that are out there are also publishing all of our different registration opportunities. I really recommend that you register on multiple places. As Dr. Garza said once early, this population is very large. So there are, just for St. Louis County, about 400,000 people who are currently eligible for the vaccine just in St. Louis County. So I know there's similar numbers in the city and in our surrounding areas too. So only sign up for one appointment wherever you get one, but it is not a problem to register at more than one place.
Can you remind us where in St. Louis County they can go get the shot? And as well as Dr. Echols, if you can tell us where they can go in the city as well.
So all of our shots are by appointment only. So you do need to pre-register with us. Our appointments make sure that we have a shot for you. We have no appointments for people who, if we don't have vaccine available for you. If we have an appointment, it's because we have a dose for you. And so we do have sites set up at Florissant Valley, as well as at our North County clinic in Berkeley. And then Dr. Echols, of course.
So in the city, we'll be using the registration list from individuals that have registered on the city's website. But for those individuals who do not have access to internet, actually, you should call the City of St. Louis Department of Health COVID-19 hotline, which is 314-657-1499. Again, that number is 314-657-1499. And we'll have someone, one of our staff will actually take your information down and register online for you so that you can have access to the COVID-19 vaccine when you're eligible.
Perfect. Dr. Holmes, can you speak to the community sites for us again, please?
Sure. We're currently vaccinating at our 1717 Biddle location, and we're following the state guidelines as far as who has been vaccinated. You can give us a call at 314-814-8700 to schedule an appointment. And we're also reaching out to our seniors because a lot of our seniors don't have access to the internet. They are not scheduling an appointment. So we're actively calling those individuals and using our community health workers to go out into the community to also connect with them as well.
Okay. Few last questions, Dr. Garza. We're getting a lot of questions about the rollout in rural areas versus in the first district. Can you speak to how, it seems as if there's a lot more vaccinations happening in some of the rural areas versus in the city and in the county areas?
Yeah, no, that's a good question. It's a little bit of a mixed bag. So the state has leaned on the healthcare systems to provide the bulk of the vaccinations, and not just here in St. Louis, but throughout the state, but particularly here in the metropolitan area, where they've utilized the National Guard has been more in those rural areas. And that's because there aren't as many healthcare providers and facilities and things like that to deliver vaccination. So you can see where there would be a little bit of a discrepancy just looking at those mass vaccination sites. But really, the bulk of the vaccinations in the state are going through the healthcare systems, some through public health and some through the FQHCs. But I can tell you that our clinics are completely full. We've been vaccinating about as fast as we can get vaccine in our doors. But that might be why you're seeing that discrepancy.
Okay. Have a live question. This town hall was really about trying to get trust in our community, to really get questions answered, to talk about trust. And Christine asked, Congresswoman, is there a reason why you didn't get the vaccine earlier when other members of Congress like the AOC did?
Okay. Yeah, so, like I said earlier, I had reservations. When we think about what has happened in healthcare, we think about what has, We think about not only the Tuskegee experiment, but so many things that have happened to so many others, even as recently as what's happened at our border with women and those hysterectomies. I needed to have the information for myself, and for me to, how can I help you if I don't even have the information? I felt it was not, I could not be a true representative if I just tell you that this is good because I heard it was good. I needed to know for myself and be comfortable for myself before I could ever open it up to say, yes, it's great for you. And that was my process. I'm all about, we from the show me, you got to show me. And so I took the steps. I did not have a provider. I don't have a doctor. I hadn't had a doctor in over 1.5 years. So I had nobody that I could call to say, hey, this is, my history. And that was a huge deal for me. As a nurse, I am used to telling my patients, you got to talk to your provider. But when there's nobody who knows your history, knows your background, that can be that can be a, a kind of a, it could be a thing. So I decided to wait until I had information. Not only that, when we look at the distribution in our communities, I also wanted to see what our community members were getting. Are you being vaccinated? If you're trying, what is the distribution in our communities, and is it equitable? What does it look like in our district? And the problem was I wasn't seeing what I wanted to see. And so I didn't want to jump out. Even if I had my question answered, I didn't want to just jump out and just say, okay, I'm going to go ahead and get it. Even though, let me be clear. And I need you all to understand, we were, the door was opened for Congress members to receive the vaccine when you all saw it was opened up, to continue for continuity of government, so that we could go ahead and do the things needed to take care of you, so that we could do the work to pass a stimulus bill, to pass COVID-19 relief, so that we can do the work to keep the government going. Because if we're all sick, how are we doing that? So that's what that was for. It wasn't to say that we're better than anybody. It was to make sure that we could continue to do the work for you. But for me, like I said, I want to make sure that my people are getting it. If y'all not getting it and I'm getting it, that was just a thing for me. So anyway, now things are rolling and I have my questions answered, so I will be getting it soon.
Thanks for your honesty and being vulnerable. We are all humans. We are people. And this, our community has been through a lot. And so you really giving your honest answer and sharing that with the community means a lot. I'm seeing people put that in the chat. So I wanted to say that to you. And I want to give, and we're over time. We wanted to end this thing at 7:30. So I want to give everyone a few last remarks. If you can do some last remarks. And again, we're just trying to make sure that the community can have trust and they can really understand why it's so important for us to be able to get the vaccinations into our community. So I'll start with you, Dr. Holmes. Any last thoughts?
Sure, I just want to again thank Congressman Bush for inviting us to speak. This has been a very important discussion. My final words is that basically, specifically for the African-American community, people of color, this vaccine is really a life or death situation. We don't want to continue to see the deaths that we've seen previously. I understand that there's a lot of distrust in the medical system, but this is not the Tuskegee experiment. This is different. So it's important for us to trust the experts, to trust science, and to take care of our community.
Thank you so much, Dr. Holmes. And you're in the community every day. You've been out there and we really, really appreciate all the hard work you're doing. Dr. Garza, we see you almost every morning giving the update. Give us some last minute remarks.
Yeah, I will echo those comments as well. One of the reasons why I participated in the Moderna trial, so I was actually one of those people in the phase 3 trial, just so I could, put a little skin in the game with this vaccination. And so the science is there. It's very solid science behind the vaccine. And we know that it protects people, especially the more vulnerable. So I would say it's it's entirely appropriate to have questions about the vaccine, but the science is very good about how well it protects. And then lastly, I would say we're still a long way from seeing the end of the pandemic. So we still need to be practicing all of those other things that we've been preaching about for so long, you know, masking, wearing masks and social distancing and all those other things. So let's not forget all of the really practical things we can do every day.
Thank you so much, Dr. Garza, for your dashboards, for your updates every morning. We appreciate it. We're watching. Spring Schmidt, last thought?
I also agree. And I think one of the things that I would add is we've been doing some community listening sessions out there and talking to our patients and many others who will talk to us. We're hearing a lot of misinformation. If you hear something that you're just like, that is not what I thought or what people have been saying, but there's a rumor going around or someone told me this, we're hearing a lot of misinformation that's going around in the community. So if you hear something that contradicts this, ask us. Get involved with the research, get some science. If somebody can't bring the science behind what they're about to tell you, then take a grain of salt, because we should be able to bring the science to anything we say.
Thank you. And last but certainly not least, Dr. Echols, one of the hardest working men in St. Louis right now. Last thought?
I just want to say thank you to Congresswoman Bush for this opportunity. As the City of St. Louis Department of Health, we aim to make sure we're providing accurate information to our constituents across not only the City of St. Louis, but across the region. And by doing that, we're able to empower them to make informed decisions about their health. Our goal isn't to coerce or persuade individuals to take a certain action, but to your point that you made earlier, we need to empower them with knowledge and accurate information. And so for all the city residents and residents across the region, everyone that's tuning in, I urge you to reach out to your local health department. We all have COVID-19 information pages. We have, in the City of St. Louis, have a specific page about COVID-19 vaccine information, which connects you to the documents that were used by the FDA to determine whether or not the two current vaccines that are available under emergency use authorizations were approved. We also have a link to the FDA's protocol for a development of COVID-19 prevention vaccines, because that sets the tone, the standard that all pharmaceutical agencies have to adhere to if they're serious about having their products approved for the general public. And so there's a lot of accurate information on our website. If you're also interested in having a representative from the City of St. Louis Department of Health attend a town hall, whether it's a neighborhood association meeting, a school meeting, our staff are already doing that as well. And so again, our ultimate goal is to make sure every resident in the City of St. Louis has accurate information so they can make informed decisions about their health. As we look at the opportunity that we have before us, with the COVID-19 pandemic, we really have an opportunity to change the trajectory for our most vulnerable population, which includes, communities of color, those who have functional needs, as well as our unhoused population. And so for us to not take advantage of this opportunity with the additional federal funding that we're receiving will be injustice, or will be an injustice. And so we're adamant about doing that as we're currently establishing our priorities for the coronavirus relief funds. Our top priority is, again, making sure that we highlight the needs of our most vulnerable population, because our city, our government, our community is only as strong as our most vulnerable populations. And so we're really adamant about making sure we take them into account, so we're truly meeting the community's needs, not only for COVID-19. So we are adamant about also not developing tunnel vision and solely focusing on what's happening with COVID-19. We have other disparities that we're working to address. This being February, this is also American Heart Month. We know that heart disease is the #1 killer for Americans across the nation, and we also know that minorities are disproportionately impacted by not only heart disease, but also asthma, chronic lung diseases, and other conditions that have resulted in poor health outcomes. And so we have to make sure we have a holistic approach for individuals to, again, achieve optimal health, and that's our goal.
All right, Dr. Echols, he's gonna get it all in there. Heart disease, asthma, he got it all in there. I appreciate you, Dr. Echols. Congresswoman Cori Bush, you have any last thoughts? Thank you, panelists, so much. Congresswoman?
I think our panelists said it all, and then Dr. Echols just pulled it all in and took us into the next month, the rest of the month. But yeah, just thank you to all of our guests. Thank you, Dr. Garza. Thank you, Dr. Holmes, Schmidt, and Dr. Eccles. Thank you to you all for being on this call, those of you that signed on and listened to this. One thing we wanted to do was we're uniquely positioned to talk to city and county because our district has both city and county residents. And so we wanted to bring it all to you at once. I know that sometimes we're looking like, well, where do I go? Who do I talk to? There are all of these different, places on these websites and all of this going on. So we wanted to try our best to just bring it all into one space. So many people are doing such great work right now. We're doing our best to give you the accurate information. That's why we called on these wonderful people to be on this town hall. We want you to be as much in the know as we can help you to be. And then for me, bringing the federal side in to be able to bring that to you as well. Missouri's first, you deserve it all. You deserve to know, you deserve to have not only access, you deserve to have care, you deserve to have the resources, you deserve to have everything you need. And so that's what we are working to do each and every day. So hopefully you got what you need, and also check out the chat because the team put so much in that chat. There are resources there. Just again, you are my priority. Missouri's first, every single one of you are my priority. We are working, this team, the office of Congresswoman Cori Bush, we are all doing the work to make sure that each and every person feels like they represent. We want you to feel the representation. Now, mind you, we've been here 4 weeks. And in the midst of that 4 weeks, we had 3 Wednesdays with these eyes, the insurrection, and we'll go into all of that. We're still doing the work, you all. So this is just the beginning. We plan to do so many more of these. So just stay tuned. I will do my best to represent you. And I want you all to know your Congresswoman loves you. I absolutely do. That's why I'm doing this work. We're doing the absolute most for all of you, starting with those in our community who have the very least. So have a great evening. Take care of one another. Take care of yourselves. Don't forget to wear a mask. And last, let me say, when you get the vaccine, that does not mean stop wearing a mask. You still got to wear a mask. All right. Love you all. Have a great one. And thanks to the team. Thanks, Cori Bush. The Cori Bush, not Congress, Cori Bush team.
Thank you so much.
Team. And thanks, Miranda. You're amazing.
Thank you for the opportunity. Further resources, please visit the website. That's all the time we have this evening. I'd like to thank everyone who joined us. If you'd like to stay in touch, you can contact our office at bush.house.gov. We encourage you to sign up for our e-newsletter, follow Representative Rep Cori on Twitter, Instagram, Facebook, and always feel free to call our office at 314-955-9980. Have a great evening and stay safe.